Dr. Kevin Kavanagh, he is he's a retired ENT from Somerset, also founder of Health Watch USA. Started out small and now has gotten quite large all across the country and even internationally. Dr. K is what we call him. Dr. K, good morning, sir.
Good morning, Jack.
Tell us about Health Watch USA, please.
Well, we're a nonprofit organization. We meet monthly. We specialize in infectious disease health policy and also patient advocacy. And like you said, we've grown quite a bit over the number of years. And right now we have a number of international members. And next Wednesday, we're actually going to have a international meeting where they'll be presenting on COVID-19. And these are infectious disease experts around the world. And that gives our group some of the insight into what's going on in the world. And believe me, this isn't a United States issue. It's not a partisan issue. It's not a political issue. This is happening everywhere. So people need to really focus on getting this virus under control.
You know, it's amazing how many experts there are out there that listen to our program, and they're always happy to correct me when they feel I am wrong. Certainly I am wrong more times perhaps than not, but not always. This is totally off topic as far as the COVID is concerned, but you're a doctor. And in fact, this would be right up your alley. I was reading a story. It was suggestions by a flight attendant giving advice on how you can sleep on an airplane. And one of the things that she said, if you have small children, you can give them melatonin. And I offhandedly said, I wouldn't do that without first checking with your physician. Somebody said, dude, melatonin is a supplement and often taken for sleep. I wrote back and said, and children taking it should get a doctor's approval, dude. And he says, no need for doctor's orders or supplements. They are not educated in vitamins. So who's right?
Well, I think doctors are educated in vitamins and supplements, and melatonin is a naturally occurring chemical in the brain. And it does help elderly people because if the melatonin goes down as you age and you take that as a replacement, it can help you sleep. I'm not sure it's going to work on children, and it's really not designed for children, so I'd be a little careful at doing that. One of the things you've got to be careful with kids is they sometimes react differently. So in other words, if you give a child a sedative, it may not actually make them go to sleep. It sometimes sedates the control mechanism and they actually become hyper and bounce off the wall. So you've got to be very careful giving anything to a child because children are not small adults. You sometimes get an opposite reaction, and sometimes things that are safe in adults are not safe in children. And that's one of the reasons why with the vaccines that we've seen, people have been so careful on giving vaccinations to children. They've required separate studies, and as you've seen, they're getting different dosages. So I would be a little careful on that. That's not what melatonin's designed to do.
All right. I read this earlier this morning and I sort of flagged it to share with you. The new Omicron variant could increase the likelihood that people will need a fourth coronavirus vaccine dose earlier than expected, according to top officials at Pfizer. Chief Executive Officer had projected a fourth dose might be needed 12 months after the third shot, but he said on CNBC Squawk Box that the timeline might need to be moved up. The World Health Organization said Wednesday that Omicron cases have been reported in 57 countries so far. According to the Washington Post tracker, more than 200 million people in the U.S. have now been fully vaccinated. That's just over 60% of the population. What's your reaction?
Well, I think it's a little bit too early, and I really wish people weren't talking about fourth doses and possiblies and all of this. We still don't know whether or not Omicron has the virulence and the lethality that would necessitate mandating or actually going out and recommending that people run out and right away get a fourth dose. It is way early on that. Now, I should state that right now, one of our major problems is the integrity of our healthcare system and making sure it doesn't collapse. So even if Omicron isn't that lethal, but yet makes a lot of people sick all at once because of its infectivity, it could still further stress our healthcare system. And of course, if that happens, you'll have a lot of patients that have urgent medical needs, or for example, cancers such as myself that need to get treated, that all of a sudden can't be treated because hospitals are filled. So we need to try to preserve as well as we can the integrity of our healthcare system. And that's really one of the major reasons why we need to go out and get vaccinated, and we should continue wearing high quality masks. And at this point, that to me means getting N95s. N95 masks are readily available now on the internet.
And this morning, lead story, front page of the Lexington Herald Leader, Governor Andy Beshear signed an executive order Thursday declaring Kentucky's dire shortage of licensed nurses as a formal emergency.
Well, Jack, that's really no surprise. And this is not COVID in the making. This has been talked about since the early 2000s.
Really?
I look back at the op-eds I've written. I wrote an op-ed that was entitled Nursing Shortage Argument Does Not Hold Water. That was in 2006. Another one in the Herald Leader, Frontline Caregivers Give Little Support in Protecting Patients. Too much expected from too few nurses. This has been going on for a long time. It's not a problem of production, it's a problem of retention. If you look at the University of Louisville School of Nursing, several years ago, they were graduating maybe 40 nurses in their BSN program each year. Now they're up to almost 240. And it's still, the shortage is there because they can't retain nurses. If they want to retain nurses, they're going to have to make a safe workplace. And unfortunately, for many nurses, that means having other staff vaccinated, so they're working around other people who have at least a shield of protection against this virus. They also need adequate PPE. They need to have death benefits, presumptive disability. You have to look out for overtime to make sure that if they're raising children, they're not being switched around many different hours. And really, you have to look at their nurse to patient ratios. They can't be taking care of tons and tons of patients. So you have all of that that's been going on for decades, and then you add on to it the stress of this COVID-19 pandemic, seeing all of these patients dying, all of these patients getting sick. Many of them could have been healthy if they had gotten vaccinated. And when they go home, they're harassed by these conspiracy theorists. So yes, it is a problem, but it's also a problem that's long time in the making.
Dr. Kevin Kavanagh is with us, and let's go to the phones. Dr. K. Larry, good morning. Thanks for calling, Larry.
Hey, Jack. I just turned the radio on. I was on my way to work. Hey, listen, just real quick. I've never heard anybody terrorize somebody or put them down because they're not taking the shot. A. B. Joe Biden, Kamala, and all of them over in the office swore them they wouldn't take that shot because they didn't trust Trump. Now they're trying to make us take a shot. They do not have the authority to do so. And if I want to take the shot, I'll do it because I want to. But it is a free country. I'm not going to be forced to take something, and especially something they didn't want to take it first, and instead they put it down and said they didn't trust it.
Well, wait. That's not true. They've never stated they would not become vaccinated.
They did.
No, absolutely not. The healthcare industry, Biden administration, transition team, they've always pushed for vaccinations. And believe me, we are in a war with this virus. If you guys don't think it's patriotic to have the draft, you shouldn't think it's not being patriotic to get vaccinated, because we don't need soldiers that are drafted. We need people vaccinated to defeat the virus. George Washington mandated vaccinations for his troops. If we don't get vaccinated, it's going to break the country. It's not only going to collapse the healthcare system, as we talked about with the nursing shortage, but the costs are just getting insurmountable. For example, if you take just the patients that were in the hospital or ICU on Friday, their entire therapy, and this is data from Fair Health, which is a nonprofit organization, for Kentucky would be expected for those hospitalized to cost $14.5 million and those in the ICU $24 million to pay for their care. Believe me, we are not, as Kentuckians, going to be able to afford the hospital care that's already been given, let alone has to be given in the future. And you have chronic care on top of that. This is a national security issue, both from economics, from the health standpoint, from the standpoint of making sure that people aren't dying needlessly. I strongly believe that our country is paramount, the viability of our country is paramount, and rights of individuals that cause harm both to the integrity of our country and to the welfare of others are not actually rights. They are something that they should put aside, and they should get vaccinated in order to mitigate the spread of the virus and the disease. Well over 80% of the people in the hospital are those who are not vaccinated. And the ones that are vaccinated are oftentimes immunosuppressed, or they haven't had their booster yet. In other words, they've been more than 6 months out from vaccination, so their immunity is waning with the Delta variant. So yes, you should be vaccinated. If you are vaccinated more than 6 months with an mRNA vaccine, you should get a booster. J&J vaccine, you should be sure to get a booster. And if you've had an infection, you should get vaccinated and view that as your booster. But I have not heard any of our leaders, including President Trump, state that you shouldn't get vaccinated.
The spike in COVID-19 infections and concerns over the Omicron variant are heading into Christmas, that is, making at-home COVID-19 test kits hard to find. Many stores and pharmacies across the country say there's in short supply the kits as people stock up for the holiday get-togethers. One pharmaceutical company told NBC in Boston that they are turning to online retailers such as Amazon to try to keep some on their own shelves. Health officials warn that the rapid antigen tests are not as accurate as the PCR lab tests, but can still work as an okay option. Have you taken an at-home test, Doctor?
Oh yeah, we tested everybody before Thanksgiving holiday. We stocked up on it early on. I mean, we talked about this on your show. We got ours from Sam's. They were $14 for 2 tests, and it's a shield of protection.
You trust them.
Well, they're not 100%, but they add a shield of protection, as does vaccinations. Nothing is going to be 100%. If you're looking for something that's for sure going to protect you, you're not going to find it. Everybody has to rely on everybody else doing their part to try to drive down community spread of the virus. And at-home testing is key to do this. Not 100%, but it does help.
Go ahead, Doc.
If you're older or you're more than 6 months out from initial vaccination, getting a booster is paramount. I think after about 2 to 3 weeks, your immunity should be pretty good at that point. And of course, you can always get a test beforehand to try to augment your chances of not having the virus. Getting a booster is paramount with this Delta variant because in reality, if you're over the age of 60 and you've just had a 2-dose vaccination, and that was back early spring, you probably don't have much protection for this Delta variant.
I hope you have a good weekend. Always good to have you on with us, Dr. Kevin Kavanagh. Thank you, sir.
All right. Thank you, Jack.